in-person Hobby Memorial Library events. We're also streaming online for our distance students and our community. We have with us today Brenda Krause. She is a CTC professor over here in the Allied Health Department, and she has a lot of initials behind her name. So I'm going to let her introduce herself and go ahead and take it away.
Thank you. So my name is Brenda Krause, and I teach full-time faculty in the nursing program. And on the side, I'm a family nurse practitioner board certified, so I have practiced for 10 years as a nurse practitioner in various settings. One being primary care, where I have dealt with allergies pretty much every day of my career when I've been in practice. So I appreciate you letting me speak on the topic, because it is a very important topic, especially when we live here in Central Texas, and probably 99% of the population in Texas has allergies of some sort. So it is important to know about allergies, what the symptoms are, what the treatments are, and just having a good knowledge base about how they can be everything from minor to very major and life-threatening with allergies. So my disclosure is that I don't have any disclosed. I am not representing any pharmaceutical whatsoever. This is for educational purposes only, so even though I am a provider, I am not in any way treating medically. I am just giving you some guidelines of what we do in practice to treat allergies, but you should always, even with over-the-counter medications, get approval from your primary care provider before you start treatment. Some of the medications, even that are over-the-counter, have side effects that can be dangerous if you have chronic issues. So always get approval from your medical provider before you start medications, especially if you have chronic conditions. All right, so allergic reaction. What is an allergic reaction? So the first time you're exposed to something that your immune system responds to, that's called the sensitization period, and the reaction is usually minor, so you may not have a very significant reaction the first time you're exposed to the allergen. It's usually when you're re-exposed that you're going to have more of a severe reaction. So an example of that would be, I went my whole life not knowing that I was allergic to red wasps, and as an adult I was stung by a red wasp, and it came out of my arm and came back and stung me again twice. So initially that first response would not have been so significant, but within about 10 minutes I started wheezing, my throat closed off, and I went into anaphylaxis. So it can go very quickly, and it can be deadly if it's not treated very rapidly when that happens. So you may go your whole life and not even know you have an allergy, and then all of a sudden you've developed an allergy to foods or to insects or to anything in the air. And it can be anything from a minor, mild, to all the way to life-threatening response. So re-exposure usually is what makes your body build histamine and release histamine related to the allergen that it is not, that it doesn't like. So it's an exaggerated immune response to an allergen that it sees as a foreign object, and it's your body's way of attacking that foreign object when it happens. So how common is allergies? Well, in the United States, 20 to 25% of the U.S. population suffers from allergies of some sort. So very, very prevalent. Texas, Central Texas, we have everything in the sun here, so we have lots of seasonal allergies that we see. And most of the time it's mild to moderate symptoms, but you can have them year-round where you're needing daily treatment to help prevent a response. So it can be anything from minor, having a little bit of itchy eyes, runny nose, sneezing, all the way to having to be on daily medications, and even sometimes allergy testing and treatment from an allergy specialist. So what people don't realize is that you can develop asthma from allergies. So allergies can trigger an asthma attack if you have allergy-related asthma, so that can be a complication for asthmatic patients. You can have what we call allergic rhinitis, which is just your typical runny nose, watery, itchy eyes, tickling throat. It can develop into ear infections, sinus infections, throat infections. We see lots of kids that come in with seasonal allergies that aren't treated that have chronic ear infections. And if those are not treated and you don't treat the underlying cause, then they end up with tubes in their ears and sometimes hearing loss and permanent deafness if it's not treated. So it can turn into much more significant problems. We can have skin allergies such as eczema. A lot of people in Texas will break out in these really bad rashes that irritate their skin from eczema, and that's all based on allergens that their body is responding to. And then you can have insect allergies, you can have food allergies, there can be lots of triggers and reasons that your body's immune system react that way. And all the way to anaphylaxis, which is the worst kind of allergy that you can have to a allergen. And if it's misdiagnosed or mistreated, then even deadly. It can be deadly if it's not treated quick enough. So allergic rhinitis, this is what we see most commonly. It's also known as hay fever. Some people get it every year religiously. A lot of times you can figure out what your allergic triggers are. So you'll know if it's pollen, you'll know if it's mold, you'll know if it's cedar, you'll know if it's whatever in the air at that season. For me, I'm allergic to mold, so every time it rains, even though I know we need the rain, and I pray that we get rain, but when it rains, I know for 2 to 3 weeks I'm going to have issues with my allergies because mold count will be high. So some people can kind of watch the news and figure out what's high in the air, if it's pollen, mold, and when they're starting to have symptoms, they know what that trigger is. So they can treat it seasonally. They can treat it only when they know there's going to be an issue. For some people, it's going to be year-round, and they're going to have to be on antihistamines or medications every day for the whole entire year just to be able to function without it affecting their life. Genetics plays a role, so there's a genetic tendency. If you have people in your family that have allergies, then typically that spreads down to the generations, and you'll see allergies related to other family history. Over 3 million cases in the United States a year, so that's a significant amount of people that deal in the United States with allergies. It affects 40 to 50 million Americans, so pretty significant problem. So symptoms, you can have congestion, sneezing, runny nose, nasal stuffiness, itchy nose, throat, and eyes. Headaches, sinus pain, dark circles, we call them the shiners. It's the black rings that get around their eyes when you have allergies. Increased mucus in the nose and throat. Fatigue and malaise, kind of feels flu-type. Sometimes people think they have the flu when it's really allergies. It can be misconstrued. Because you can even get a low-grade temp, which a lot of people don't realize that this is an inflammatory process. So when your body has inflammation, you'll start to get like a 99 up to a 100.2 degree fever. And that they might think that's an infection because they're running a low-grade fever, and it could be inflammation from the allergy response. Sore throat from mucus dripping down the back of the throat, wheezing, coughing, and trouble breathing, which is your more significant reactions. So lots of causes that can cause seasonal allergies: dust mites that live in carpets, drapes, bedding, and furniture, pollen from the trees, grass, and weeds. You can see pollen exploding in the air sometimes, and that's when you know you're going to have issues. Pet dander, some people are allergic to certain cats or certain animal dander. Mold spores, and then cockroaches, their saliva, and their waste. So those are some very common causes that we see that cause seasonal allergies. There's many, many more, but those are common ones that we see. Okay, so treatments. Again, these are just generalized information for treatments. Antihistamines that are over the counter. This is such a prevalent problem. Most of your allergy meds are now over the counter. There are very few that are actually prescription now because we have such a big, huge problem with allergies that the insurance don't want to pay for the medication, so now they've all gone over the counter so that you can pick it up over the counter. So antihistamines dry up fluid and block the histamine release. So Benadryl is probably one of your most sedating. So these have everything on the spectrum from making you sleepy to not making you sleepy. So with antihistamines, if you're going to take an antihistamine, you kind of need to know if it's sedating before you go out and operate heavy machinery or something. So you don't want to drive right after you take Benadryl because you're probably going to fall asleep at the wheel and cause an accident. So antihistamines, Benadryl, Claritin, Zyrtec, Allegra, Zizal is the new one on the market. So there's lots of different antihistamines. What they do is block your body from releasing histamine, and they help dry up some of that fluid that's there from the response. Decongestants dry up all that fluid that's in your inner ears, can help prevent infections in the ears if you dry all that up. Bacteria likes to go to a dark, wet environment. So if you have fluid sitting in your inner ears, bacteria will go there, and that's why we see recurring ear infections and sinus infections from allergies. So decongestants, there's Sudafed. There is pseudoephedrine. I don't know if you guys are familiar, but when meth labs became prevalent, they took pseudoephedrine off of the shelf, and it's behind the pharmacy counter now. So you have to show your driver's license and request it from the pharmacist because they can only give you so many in 30 days now to control meth reproduction. So it does dry up well. It's very useful. It does, however, cause blood pressure to go up, can cause your tachycardia. So if you have underlying heart conditions, you should definitely steer away from using the decongestant category. And then Afrin nasal spray works really good to open up your head and helps relieve the congestion, but it shouldn't be used more than 5 days in a row, and if you're using it, it is addictive if you use it too long and too often. So decongestants are very useful if used appropriately. And then leukotriene inhibitors. Singulair came out on the market. Actually, it was a medication produced for asthma. But they started seeing really good promising results with allergies as well. So they used to only prescribe it for asthma. It is a prescription. You can't get it over the counter. But if all these other treatments are not working, your primary care provider may recommend adding Singulair for allergy control. And if you do have asthma, it's a great drug to use for both because it helps prevent asthma attacks and it helps kind of prevent your allergy reactions. So that one is not used as often, but it is very useful if it's used. With Singulair, you just have to know that it can cause some really strange nightmares and dreams, which is not a real common thing to have happen, but I have actually had to take people off of it because they were having really, really strange nightmares with Singulair. So just something you want to watch closely for. All right, so corticosteroid nasal sprays. This is your Flonase, Nasacort, Rhinocort. These are all over the counter. This is actually one of the first line treatments that are recommended because it's a local anti-inflammatory and it blocks the allergens from entering into the nose, which is one of the most common routes that it is transmitted. So it can actually knock out inflammation and block that entry into the nose. So the corticosteroid nasal sprays are one of the first line treatments. And then if you've tried antihistamines, decongestants, you've used your nasal sprays, you've done all of that and it has not helped, you can go to your primary care or an urgent care and get a steroid shot, which is a systemic anti-inflammatory response. You have some patients that deal with hay fever every year that will come in saying, I need my Kenalog shot because they just know what it is and what they need to make them feel better. And so you just can't overuse steroids because it has its side effects as well, but usually once a year, it's a good relief for people who are suffering from allergies. And then immunotherapy is where you actually go to an allergy or asthma specialist and you get tested for allergies with the skin prick test, and they can do blood draws now that can test for certain foods, it can test for certain allergens. And then they build a serum based on what you're allergic to, and they desensitize you with exposing you to that over time. So it used to only be in shot form, but now they make sublingual liquid and tablets that people can take at home. They just want you to make sure you're in the allergy clinic for the first several times you take it in case you have an anaphylactic reaction. You're there where you need treatment. But some people have significant enough allergies that they have to go to the specialist to control their symptoms. So mild to moderate treatments, this is just familiar things you see in an NP practice. They're going to start with intranasal steroids daily, or at least during the season that you're going to have issues. And then avoiding the allergen exposure, which isn't always realistic because you have to walk outside at some point. So, but keeping your windows closed, pulling up carpet and having hard floors is much better. It doesn't harbor the mites and the dust. So a lot of people in Texas, if you have kids with bad asthma, the allergy specialist will say, get the carpet out of the house. Don't have stuffed animals laying in the bed because those just harbor mites. So trying to avoid exposure. And then if you've been outside in the elements and you know you've had exposure, coming in and taking a shower and getting all of that off of you when you get into the house is also important. So trying to avoid those known exposures for sure. Oral antihistamines, it can be as needed or it is sometimes daily, every single day. What some people don't realize, you can be on Allegra every day for 5 years, but what happens is your body builds immunity to that antihistamine. So if you don't switch it every 6 months, then it will weaken its effect and it won't be effective anymore. So you'll hear people say, well, I'm taking it every day, but it's not working. And then I'll ask them, well, have you tried switching to a different antihistamine and then going back to that one? Because it tricks your body into seeing it for the first time again. So I always recommend every 6 months that you switch it to a different one and then you can go back to the one that you like. If it's Benadryl or Zyrtec, I usually tell them to take that at night because it is more sedating than your Allegra and your Claritin is. Decongestants, again, just have to be cautious if you have high blood pressure, heart problems. You don't want to be taking Sudafed and causing more issues with your heart than you already may have. Afrin, again, not more than 5 consecutive days, and if you use it too long, it is addictive, so you have to be very cautious about Afrin. And then systemic steroids is your Kinalog shot, or even they may do like a prednisone pack or an oral steroid to calm the inflammatory response. Singular nightmares, you just have to watch it close and caution that it can cause some suicidal and depressive ideations as well. And then if all of that doesn't work, you get referred to an allergy specialist where they actually evaluate what you're allergic to and come up with a treatment plan that is more beneficial to give you a better quality of life. And then allergy-induced asthma. Asthma is an inflammation in the airway and bronchioles in the lungs. It can be life-threatening, and the way to open up that alveoli in the lungs is with a bronchodilator. So if you have asthma or you know your child has asthma, you should always carry an albuterol rescue inhaler, and you should always make sure there's an asthma action plan. You can actually print them off. The schools have them. If you have a child with asthma or you have someone that you know has asthma, you should always have an inhaler, because you never know when an allergen is going to trigger that inflammatory response and close off your airway, and then you're not going to be able to breathe. So always make sure there's a plan in place for that. And pulmonary function tests, if asthma is severe enough, you go through a pulmonary function test and you go to a pulmonologist for testing and treatment for your asthma. Anaphylaxis, there's also treatment plans and algorithms out there on the line that you can print off, but basically if you have an anaphylactic reaction, you need to get Benadryl and epinephrine on board as fast as you can. Epinephrine will help prevent your heart from stopping. When you have anaphylaxis, your respiratory center and your cardiac center shut down. So it goes all the way into decreased blood pressure, they can just collapse on the floor, airway closes off, and within minutes they can stop breathing and their heart can stop from an anaphylactic reaction. So it can be very, very serious. So if you know, you should always know your history of allergens. If you know that you've had an anaphylactic reaction in the past, you should always have an EpiPen with you. You should always carry Benadryl with you, just in case you have an exposure to something that causes that kind of reaction. So it's an acute, severe, life-threatening allergic reaction that involves several organ systems, and then symptoms are they can break out in a rash, they can start wheezing, get shortness of breath, Stridor is a really loud, high-pitched noise when you have inflammation in your airway, and that's the only air that's getting out. It makes a really high-pitched noise. And that they'll start having stridor, their blood pressure will fall, they'll get real anxious because they can't breathe and they feel the impending doom. And nausea and vomiting is very often common when it's anaphylactic reaction as well. So treat immediately with Benadryl and Epi if it's available. Calling 911, getting that help to them as fast as you can is the key. So they may not have their EpiPen on them, and they may not have their Benadryl on them. So if that's the case, then you try to keep their airway open, you lie them down, make sure that they can't injure themselves, and call 911 immediately to get emergency response team there. So treatment for anaphylaxis is Benadryl and Epi. So epinephrine comes in an auto injector now. It's very easy to give. It has the needle already in it. You pull the cap and stab your leg, and it automatically injects it. So it's pretty easy. There's a pediatric dosaging and an adult, but you would get this prescribed by your primary care provider. If you know that you have a history of that, you definitely want to make sure you mention that you need an EpiPen prescription. Okay, so I told you about the wasp sting scenario with me. The other experience that I wanted to share with you is how serious this really can be. So as a patient, I was given an antibiotic as an inpatient in a hospital that I had never had before, and I had a reaction to it at that local hospital. I got transferred to another hospital and had an allergy band on and required surgery. When I was in surgery, the CRNA gave me that antibiotic again that I had the reaction to, and I died on the operating table. So they did get me back with a lot of effort, but that's how significant that history can be. And there can be mistakes that happen, even if you are, have an allergy band on, even if you know what the reaction might be. So as a medical professional, that was very difficult to live through that experience. And so for me, I have a passion about allergies because I know how deadly and significant it can be. I've seen a lot of people have anaphylactic reactions. I've treated a lot of patients, and even though you ask them, have you ever had a reaction to the medication I'm prescribing you, they can say no, and they might have had it in the past and not reacted. I treated a patient with an antibiotic for strep, and he had had it before, no problems, no allergies to it. But I always educate because I just want them to know, he'd had a reaction to something else, but not that one. So I basically said, I'm going to prescribe you an EpiPen. I'm going to prescribe, make sure you have Benadryl in the house. And when you take this, if you have trouble, then you need to inject, call 911, and go where someone can find you. And that's exactly what happened. He took the antibiotic, had an anaphylactic reaction, walked outside while he called 911 so they could find him, collapsed in the yard, but they were able to save him. And he came back to the clinic the next week saying, if you hadn't have told me all that, I would not be here today. So it is very important to be educated in allergies because it can be significant and life-threatening. It's such a prevalent problem that you're not going to escape allergies of some sort probably in your lifetime. I didn't have allergies as a child, but as an adult, I grew in Central Texas to have allergies to a lot of things. And so it definitely is a significant problem in not just Texas, nationwide, but we have lots of allergens here, so we see it a lot. All right, any questions?
I have two. One, two of my children, as they became adults, started to get food allergies, but never had food allergies as children. Does some of this develop as an adult?
Mm-hmm. Absolutely. You can even have adult onset of asthma. We never had asthma as a child, but then have an adult onset of asthma. So it can be from just being exposed over time that you build a little bit of histamine each time, and then eventually you have a bigger reaction because you've been exposed. And then some kids actually have allergies and asthma as children and outgrow it by the time they're adults. So they've research has shown that if you treat them fairly aggressively younger, then they can typically outgrow it and not have as much problems as an adult. But it's when they don't come in and seek treatment, and every time you see the kid, they've got snot running down their face, and and so you tell them, you want to make sure you're treating these, because I've seen kids with permanent hearing loss because they didn't get treated for their ear infections. And once you've had 5 ear infections, they should be referred to ENT for tubes. Kids' eustachian tubes are shaped differently, so they don't drain the fluid off. So that fluid just sits there and bacteria will get in there. And so they put little rubber tubes in there so that the fluid can drain out, and that will help prevent hearing loss, permanent hearing loss from chronic infections as well. And I've seen lots of patients have to have sinus surgeries from allergies just because they have chronic mucus and inflammation in their sinus cavity, which your sinus cavity is close proximity to the brain, so you can get lots of issues with infections. And that's the last place you want it, is by your brain. So treating sinus infections is also very important when you get them, because they can turn into long-term problems too.
My other question, is there such a thing as being allergic to vitamins? And the reason why I say this is because I was taking like vitamin D, and then I introduced, and I get out in the sun a lot, so I get natural vitamin D, and then I introduced vitamins, and all of a sudden I started to break out in hives. And then when I took it again the second time, I really started to break out everywhere. And then I started to panic the third time that I couldn't. And then I did some research about vitamin D staying in your system. So, I mean, of course I cut it all out. But, like, I don't know what I got. But is it possible that there's an allergy, or is that more of an OD? Of vitamin D. Did I OD on vitamin D?
It's usually the preservatives they put with the vitamins that you have a reaction to, not the vitamin itself, but I've seen people have reactions even to antihistamines, which are supposed to be life-saving. I've seen people allergic to Benadryl, but it's usually the red dye in the Benadryl or the dyes in the Benadryl. So I've seen people allergic to, I had a patient that she was coming in, I mean, her throat closing off, and we couldn't figure out what it was she was allergic to, and then I started asking her, okay, so have you been burning wood in your fireplace? And that's what it was. She was allergic to the wood she was burning in her fireplace, and it was causing, she almost died a couple times before we figured it out, because her throat would close completely off and she couldn't breathe. And that was, she had inhalers, she had a nebulizer, she had everything, and it's still just barely got to the hospital a couple times. So it can be something that you just don't even think about, and sometimes you never even figure out what it is unless you get testing, because you can go on for a long time just treating it and not really knowing what the trigger or the allergen is for a while. But I've seen a lot of kids allergic to red dye in different things, so sometimes they can't have certain sodas or food or coloring in their food, and because they'll have reactions to that. But yeah, I've seen reactions to some pretty strange things that you wouldn't think people would react to, but they do. It's all in their own immune system, what they respond to. Any other questions?
I actually have a third question, but I was going to let other people.
Someone's asking questions.
I'm sorry, I'm the class annoying person.
There's no such thing as a dumb question. Someone else probably has the same question. They're just not asking.
You had mentioned that you had a wasp sting you, and then the second time it was really terrible. Years ago, I was bitten by a assassin bug. That's those little triangle bug things, and immediately had a reaction, swelling and everything. So does this necessarily mean that if I tangle with an assassin bug again, it's going to be worse?
It could be. It definitely could be. If you had that significant of a response the first time, being exposed a second time could be even worse. So by the time I got to the hospital with my wasp sting. We live pretty far out in the country. By the time I got there, they said if I got stung again by a red wasp, I would not make it to the hospital without epi. So I have to have epi pretty much everywhere I go because red wasps are everywhere in Texas.
Yeah.
And my kids play sports, so I was always on the fields with red wasps flying around me. And it gives you a very healthy fear. I run, which I know you're not supposed to, but it's hard not to when you've had a reaction like that where you almost quit breathing. So you're going to respond by trying to stay away from it, but sometimes that doesn't really help. So always better to be prepared with Benadryl and epi and have what you need to. I have my neighbor's son was allergic to peanuts, which is a very common allergy, but at the school, even though it was listed all over his stuff, still gave him peanuts like 3 times, and he had anaphylactic reaction when he got nuts in the school line. So it can be pretty significant. That's why I think educating is so important. Having a plan, making sure that yourself and your family are safe from bad outcomes happening, for sure.
Is EpiPens that you have a prescription, right?
Yeah, that's a prescription. And for a while we had a national shortage. Imagine that, because the problem is so prevalent. So they told you don't even get rid of your expired epi because some epi, even expired, is better than none if you have a reaction. So people were holding on to their expired epi for a while until they could get some more on the market. But yeah, you should. It's a prescription that your primary care would have to write, or urgent care, wherever you go. Hopefully, if you've ever had a severe enough reaction, they don't let you leave there without one, without a prescription. But I've seen it happen. I've seen people come in and tell me they've had anaphylactic reactions who were never even asked if they had EpiPen. So it's not always thoroughly treated.
Can someone get the catalog shot before doing the allergy testing?
Yeah, a lot of people come in, they don't do allergy testing because they know it's seasonal, something in the air that triggers it. There's a lot of people who will come in and ask for a catalog shot just to get them through the worst part of the season. And you don't have to have testing for a catalog shot. It's just, catalog is a steroid. And so you just, with steroids, they have side effects. They can cause some edema. They can, if you're using them, overusing them, they can cause kidney issues and fluid retention. So you just don't want to use steroids, back to back to back. But once a year or a couple of times a year is usually very effective, and there's not that many bad effects if you're doing it just occasionally. They say no closer than 3 months apart should you have a steroid shot. So, but you can have a shot and then have pills, just not systemic, more than every 3 months. Any other questions? All right, well, I appreciate your paying attention and coming to the presentation.
Well done. Thank you so much. Thank you so much. We've learned so much with this. I mean, it's like something everybody suffers with. So, thank you guys. Thank you guys for watching online as well. And don't forget, next Wednesday we have CTC astronomer Warren Hart doing the virtual night sky tour next Wednesday. So, thank you again, and we'll see